Okay, so last chapters, so we didn't get through the whole book, but a lot, like the chapter on diabetes, we go over that quite a bit in medical emergencies. We'll go over that a little bit in oral path. The one on local anesthetics, you guys have already been over that. So some of them I knowingly skipped, and I really do feel like we got through the biggest majority of the chapters, even though we didn't quite get through all of them. So, but these are just the last couple. So 14 and 17, and then there's also a little bit of just about asthma in there as well. Okay, so epilepsy. Do you guys know what epilepsy is? What is it? Can you describe it to me? What happens if, yeah, it's seizures. It's like a seizure disorder, somebody that has seizures. So it's involuntary behavior in the neurologic, in your brain, pretty much. Do we know why this happens? We don't. Like, most of the time we have no idea, which seems so dumb that you can't figure out what is going wrong in the brain to cause your whole body to convulse. But we don't know why. We're not quite sure. So that's considered idiopathic. Make sure you know that term for the test. So there's two different types of seizures, generalized or partial, and then within those, they're also divided. So partial seizures, it's only one part of the brain that's involved, and it can be a simple or a complex. So simple, there's no loss of consciousness. The person could almost just kind of like stare off into space for a minute and then be right back. You wouldn't even notice it. A complex, there's loss of consciousness for a few minutes, and then again, it comes right back. Generalized seizures, there is loss of consciousness and no true aura, which means sometimes they have like a sensation, light, they can see light, they can feel something, they can sense something before they go into a seizure. So if these ones, they have an aura. This one, there's no true aura for generalized seizures. And I think that is a question on the test, which one has an aura or not. So within generalized, there's two different types, absence or tonic-clonic. So a lot of times you're gonna know them by petit mal or grand mal. I think you've probably heard of grand mal seizures more so than tonic-clonic. So the grand mal seizures are the scary ones, the crazy moving all over, jaw really tense, like all really scary seizures. The absence seizures, there's not a lot of movement. The person going through it doesn't know that it's necessarily happening, and it usually lasts for a few seconds. I had a roommate that had seizures, that had epilepsy pretty bad, and she would have seizures quite often. She did have an aura, and so she would be able to get to safety before, it happened most of the time. Every once in a while she would have one, or I think sometimes too, it's like she knew it was coming, but she didn't quite get where she wanted to. She didn't have time. But it was debilitating to her. I mean, she couldn't drive, she couldn't get a license. She did work, but she had to, she was a bagger at a grocery store. That's pretty much the only job that she could have. And they had this little safe spot right near where she was, so she could go and if she was gonna have a seizure, and so I mean, it was a very understanding grocery store that she worked at that could deal with this. So, but epilepsy and seizures are a pretty big deal. Okay, so some medications that will help with them are Dilatin or Phenytoin. So they work by suppressing the CNS, gingival hyperplasia in 50% of patients. That will be a question on boards and on the test about which medication can cause gingival hyperplasia. So what is gingival hyperplasia? We know it's in the gums. What's hyperplasia mean? You know what it's going to look like? Excessive tissue, exactly. So hyper is too much. So it's going to be these, and I'm sorry, I should put a picture on here. But it's very fibrous, meaning it's very, if you were to touch it, it's very dense. It's not spongy at all. It's very dense and firm, but it's just this tissue overgrowth in their mouth. And it happens in a lot of patients, but they don't know why. Again, it is unknown why that works, why that happens. They think there could be related to this or this, but there's just no clear-cut reason why that happens. A lot of times patients end up needing surgery to reduce the overgrowth of gums so that they can care for their teeth properly. So, I mean, if your gums are just overgrowing up underneath, in a sense, you're going to have a pseudo pocket. You're going to have a deeper perio pocket, not because of bone loss, but because of inflammation in the gums, and it's going to be much harder to clean underneath there. So a lot of times they have to go in and have surgery to reduce the amount of gingiva that they have. Phenobarbital is also a really common one, but that one causes sedation. So if you have epilepsy and you have to take a medication every day, you're not going to want to take phenobarbital when you wake up in the morning and expect to function throughout the day. So a lot of these meds too are very sedating, meaning you get really tired from these meds, and then you get tired from a seizure. And so a lot of these patients sleep a lot. My roommate slept a lot. That's why I liked her as a roommate. She was quiet. Okay, Tegretol is also one. That one will treat partial seizures. This is on the test. Which medication is used to treat trigeminal neuralgia? It's Tegretol or carbamazepine. Okay, so some antihistamines. Isn't this a disgusting picture? Shows you why you need to cover your mouth when you see it. Okay, so Benadryl, we should all be very familiar with that. It's going to block histamine. It blocks the H1 or the H2 receptors. Usually, this is used mostly to treat mild allergic reactions. Has anybody not taken Benadryl in here before in their life? Does it make you tired or make you hyper? Tired. It makes me tired too, but it can make some people quite hyper. I had a coworker that she would never take Benadryl because it just like ramped her up, which was so weird to me because I just want to do nothing but sleep when I take it. So the side effect, xerostomia and sedation. So antihistamines, you want to take that. What happens when you have an allergic reaction? What's happening to your body? What are some like side effects of an allergic reaction? Hives, what else? I think of like if you're allergic to pollen, what are you feeling? Itchy eyes, watery nose, like kind of coughing, those kind of symptoms. So a Benadryl is going to block the histamine, which is going to, and the reason why your nose is running and your eyes are running is that histamine gets in your, or the pollen gets in your eyes. Your eyes and your nose are trying to get rid of it by activating the snot and the tear ducts to get it out of your body. So the histamine blocker is going to go in and block that reaction, which can lead to a dry mouth, like you can get nosebleeds from it sometimes if it dries you out too much and all of those things. So just think of the drug, it's kind of counteracting the side effects of it. Claritin and Zyrtec, those are also antihistamines that are just, they don't sedate you. I take the Zyrtec, it's the cetrizine, the SAM brand of Zyrtec. I take that every day through most of the summer just because I get a little bit allergy here and there, and that seems to take care of it pretty well. Okay, so now we're going to talk about asthma a little bit more. So in this slide, really pay attention. Look how much different it is. I think it's a good one to visualize the difference. I mean, just looking at this, if your bronchioles in your lungs were like that, I mean, you can tell how much more difficult it is to be breathing. So asthma is reversible. It is not a permanent condition. And then it's defined as inflammation of the respiratory airflow. So if you're not allowed, your body's not allowing you to either breathe in or expel as much. Expel? Am I saying it the same way every time? Whatever, you know what I mean. Breathe out, exhale. Well, let's just say exhale. That's better. Okay. So with the asthma, obviously you need to get those bronchioles open more. So you're going to need a bronchodilator. So dilator, it's going to dilate, it's going to make them bigger. That's what you're going to need in order to help with the asthma. Some examples are albuterol or Ventolin. So immediately relief versus long acting. When are you going to use? Why are there two different types? And when would you use them? Which one would you use for an asthma attack? Mm-hmm. And so what about the long acting? Some people just have such bad asthma they need to take an inhaler every day. What about like COPD? Somebody who has chronic lung breathing issues, they would take this a puff every day, or two every day, in order to just maintain it open. And then they probably also have a now short immediate relief one that's short acting as well. So you also need to reduce the inflammation. So that red bronchial that's red and swollen, you need to reduce it with a steroid. So any steroids are really, really good to reduce inflammation. Aspirin should be avoided in people with asthma for some reason, and I don't know what the connection is, but 20% of asthmatics are allergic to aspirin. Hopefully you guys remember that from when we talked about the aspirin chapter. Asthma can be worsened or increased by stress, allergens, exercise, or upper respiratory infection. So that's why asthma is somewhat of a concern in the dental office, because it's stressful. So a lot of people, it's a really good idea to have, that's why we have you make sure that it's out and close by. The last thing you want to do is have to go look for it. The only time when we don't ask you to make sure that the inhaler is close by is if it's exercise induced, because they're laying still, they shouldn't have an asthma attack from laying in the dental chair. Okay, so you need to know a little bit of the difference between these. The albuterol, which is the more short-acting immediate relief, versus the steroids, which would be a long-term. Know which one is know which one is long-term, which one is short-term, which one would be for an emergency versus every day, and then just know most of these. Flovent is another really common one that I've seen. Make sure you know this for the test. Advair Diskus combines corticosteroid and a bronchodilator. So that one drug combines both of them. Okay, that is on the test. And I think that's it, right?